Let's Talk Parkinson's event brought to you by Parkinson's Community Los Angeles. Today, in honor of National Family Caregivers Month, we have a special discussion among Parkinson's caregivers. I'm Judy Yaris, Vice President of PCLA. For those of you that don't know me, my husband Sandy had Parkinson's disease for 18 years, and I was his caregiver. And for those of you who don't know PCLA, we're a Los Angeles-based nonprofit that supports families living with Parkinson's through all of our free online education events, support groups, our information and referral program, and so much more. Today's event is brought to you by our sponsors, Abbott, AbbVie, Boston Scientific, Medtronic, and Synovium. Our programs are also made possible by donations from the Parkinson's community. If you appreciate the programs like this one, please consider making a donation to our website at www.pcla.org. Before we get started, I have just a few quick rules and notes for you. We are recording today's event. Your image will not be visible in the video. Please stay muted to keep background noise at a minimum. If you have questions or comments or want to share resources, you can type them into the chat at any time. If you'd like to join the conversation, please raise your hand so we can call on you. Our panel today covers a wide range of caregiving experiences. You'll hear from care partners, Nessa, Sarah, David, and Mary, and child caregivers to a parent with PD, Maya and Charles, and Ernesto, a paid caregiver who will be joining us halfway through. Our moderator, Nessa Wyman, has been a care partner to her husband, Mike, for over 20 years. She's also one of my dearest friends. She's been active as a Parkinson's advocate since Mike was diagnosed at age 36. And she runs 2 of PCLA's support groups, including one for the young onset community that she co-runs with Mike. She and Mike are founding board members of Parkinson's Community Los Angeles. Nessa, thank you for moderating this wonderful discussion today.
Oh, it's my pleasure.
Over to you.
Thank you, Judy. So my husband has had Parkinson's for 21 years. He got it when he was 36. So all of my knowledge is from Parkinson's and running support groups. So one thing that I want to share with you caregivers is that your best friends in this process and your go-to people are often going to be other caregivers, because unfortunately other people, often including other family members, just don't get the physical and emotional toll that care partners face. And it's so hard to explain to others exactly how it feels. You might have to find new sources of comfort and companionship. And they don't have to be just PD caregivers. I find all caregivers of anything to really get it. And I find that those are the people that I choose to be my best friends as well now. But I'm going to start out by going around and ask everyone to introduce themselves and tell us a little bit about your caregiving journey, just like 3 minutes each. And let's start with Charles Scheel.
Good evening, everyone. My dad was diagnosed at the age of 53 back in around 2006. I didn't actually find out because that same year I had actually moved from Denver to Los Angeles. And I found out a few years later, everything was fine. But around 2014 was when the decline really became obvious. And my experience is different than a lot of caregivers, because a lot of caregivers are there day after day after day. And the decline can seem somewhat shallower because you're there every single day. But seeing my dad only once every 6 months, I was able to see the big leaps in decline. And I was able to also use some of my experiences to see some of the logistical and behavioral challenges that were facing my mom and my dad, from organizing the layout of their condo better, eliminating trip hazards like rugs and creating more floor space, to also making sure to properly emphasize hydration. And unfortunately, it sort of went through a sort of staccato element through the years until the pandemic hit. My parents' experience got really bad in 2019 when they were forced to flee their condo due to flooding. They were put into a hotel room that was technically ADA, but ADA does not actually meet the needs of Parkinson's patients and caregivers. And my dad ended up falling off the toilet and crushing his face, and he went into a skilled nursing rehab facility. And I spent a couple of months prior to the pandemic with my mom trying to help them. We actually managed to educate some of the nurses quite a bit on the needs of Parkinson's patients, but we also learned a lot about how overworked and understaffed a lot of these facilities can be, and not really, despite spending $10,000 a month, not really providing the type of personal care that you would want for your loved one. In the middle of the pandemic, me and my girlfriend decided to move back to Denver to help get my dad out of the facility and at home with my mom again. And that happened last November. And we had things going pretty good for a few months. He was on hospice care. We had a whole bunch of tools at our disposal, the sit to stand assist lifts, Hoyer lifts, you name it. But he unfortunately ended up passing in March. But we do have a lot of experience and are hoping to be able to, as best as possible, convey our experience and knowledge to help you guys and hopefully make your journeys at least a little bit easier to tolerate and deal with.
Thank you. I'm sorry for your loss, for sure. David, how about you? Introduce yourself.
Hi, I'm David Miles. I live in San Diego with my husband, David Higgins, in the sort of North Park district of San Diego. David was diagnosed actually 10 years ago this month. Turns out Parkinson's is kind of his family tradition for him. His mother had a form of Lewy body dementia. His grandmother had Parkinson's, some uncles, great uncles. So when he was diagnosed, he had some idea of what was coming. And more than that, both of us worked in, are molecular biologists, molecular geneticists, and worked in biotech. David actually is in his last position was actually working on a Parkinson's therapy. So we understand the biology and the process pretty well going into it. And over the past 10 years, it's been actually, we've been really fortunate. David's progression has gone relatively slowly, which is great. Today, 10 years in, we're experiencing sort of shifts in how well the medications work. His off periods are definitely coming up more and more frequently, and he's presented with more challenges than he's ever had before. So part of that experience for me as a care partner has been one of initially being sort of a bystander and gradually evolving into more and more of a partner as we go along. And that's a process that I'm still learning. I'm still learning from others. As Nessa said, your care partner friends become really essential as you go through this. David actually started a small support group after what they called a Good Start workshop at the Parkinson's Association of San Diego, just a couple of years after his diagnosis. And that group of about 6 or 8 people has turned into, we manage now support group with about 500 people in the mailing list around San Diego County. Of course, with COVID, we've gone completely virtual. We were nervous about that at first, but our experience for those who come has continued to be really good and positive. David leads a Parkinson's specific groups. I lead the care partner groups. We have a group that meets together once a month on Zoom. The care partner group has been meeting almost weekly, and it's as much just about supporting and listening to each other as it is talking about Parkinson's at this point. As I think as Nessa said, these are folks who, from all walks of life. It's one of the odd things about Parkinson's, I think, that it's an opportunity, if you will, one of the sort of silver linings that you get to meet people you would otherwise never have the chance to meet. No surprise, they're consistently wonderful, caring, supportive people with each other. So I see some familiar faces in the gallery view right here. So it's really a pleasure to be here, and I look forward to the conversation. Thank you.
Thank you. All right, Sarah, can you tell us a little bit about your journey?
Yes. My name's Sarah Douglas. I live in Altadena with my partner, Travis. He and I have been together almost 14 years this month. And he has had Parkinson's since 2014. So I think that makes it around, what, 8 years. He had funny symptoms before that, though. Like, it's funny when the diagnosis happens, you don't know. You look back and you're like, oh, maybe that was Parkinson's, but I don't know. His disease has progressed pretty rapidly. He's had DBS twice, and he's pretty up there on the medications. And I work full time. Struggle to keep up with everything, but he's a very independent person. He takes care of a lot of this stuff himself, and he needs to be a little better about asking for help some days, but he's getting there. And I'm getting there with providing help. I haven't been to any of the support groups. Most of them happen during the day. Yeah, we have 2 dogs and 2 cats, and we enjoy a lot of outdoor activity. We camp a lot, we hike a lot. Travis likes to climb mountains. I sometimes climb mountains with him, though I don't like it as much. I know we've done a lot of outdoor activity even with the Parkinsons, and sometimes it's a struggle, but it's a lot more fun than just hanging out at home. So
Exactly.
Yeah.
Great. Thank you.
All right, thanks.
How about Maya? Can you talk to us a little, unmute yourself and tell us a little about your story?
Hi, my name is Maya Haywood. I help take care of my mom who has Parkinson's. She's 70, almost 77. She was diagnosed about 3 years ago. At that time, she was still working as a therapist. She's been retired for almost 2 years, and really in terms of helping her and realizing how much help she needs, it's gotten much different in the past 1 year, specifically since she broke her hip, and that was last November. So before that, I mean, I don't know, yeah, it is kind of funny when you look back and see, what were those earlier symptoms and how does that relate to what's going on now? But I mean, she was walking with a walker, but not consistently, or, before that using a cane. And then she fell and broke her hip. And at that point, I mean, it was before vaccinations, and it was very stressful for myself. It was very stressful having my mom in the hospital and not being able to visit her. I just insisted that she come straight home. She lives with my sister, and that we would figure out how to help her I didn't want her to go, anywhere like what the hospital people were recommending, like a skilled nursing or something, even though she couldn't walk at all at that point. And since then, we just make sure there's someone with her at all times. So that's for 6 months, it was just my sister and myself. And then we did hire a caregiver once I was planning on going back to work. I'm a preschool teacher. I work at a Royal Nature School in Pasadena. So it's like outside preschool. And before that, I worked at Pacific Oaks. So I was basically unemployed. So it was sort of like convenient time for my mom to need so much help. But, it's been very intense, like the level of being there every single day. And, now I'm there. Now I have a full 24 hours off and, can do other things as well.
Exactly. Great. And we have Mary also.
Hi, I'm Mary Gasquier, and I wanted to briefly go back to when Charles and I met, because I think that's part of the Parkinson story, the pre-Parkinson story. I was living on the other side of the country and came out here to Big Sur to a Tibetan Buddhist meditation workshop. And I ended up moving here to be with Charles. So that was 20 years ago. And after I moved here, we both retired, lived quite a life of adventure that we had not been able to do in our previous profession. So we could travel and have lots of adventures and hike, do art, music, and so forth. So we were living a very full life, but then but kind of because Charles started having these strange symptoms happen. For example, loss of sense of smell. We wrote that off to the fact that he had a deviated septum. We thought, oh, well, it's because of that. Then he developed a little tremor, and we thought, okay, that's a central tremor because he had a hiking injury that severed a nerve in his hand. And so just this whole little constellation of symptoms, and starting at about, I'd say 2013, they started coming more fast and furious with listing off to the side when we walked, and all kinds of mysterious symptoms like nausea and skin problems and allergies and one thing and another. And we went through 4 years of his not being diagnosed. So we were told by our primary care that he was just anxious and depressed. We were told by, although she did refer us to a movement disorder specialist neurologist who told us that Charles did not have Parkinson's. So we were like, that's good, And then after all this going around about in 2017, he was diagnosed with Parkinson's, started on Cinemat, and then he has already had severe restless leg syndrome. So he developed really severe augmentation, and to the point where he was walking the streets of our neighborhood at night, unable to sleep, unable to rest, unable to sit down. So he was weaned off Cinemat, put on Nupro. That was taken up. For people who don't know, these are standard Parkinson's medications. He developed really severe augmentation with that. That means the restless leg just getting worse and worse and unremitting. So finally in 2020, he had deep brain stimulation. And that was a whole journey unto itself that was very difficult for quite a long while, but that brings us to now, and that's where we are. So, and I'd say we're still quite active. The DBS has been, after the rough patch, it's been like a miracle. And so it's allowed us to regain quality of life, and allowed Charles to be able to do so many activities that he couldn't do before, or was very hampered previously. So we're really thankful for that.
That's
where we
great.
are today.
I saw a lot of heads nodding in and around when I look around. So I see a lot of people who are kind of agreeing with some of the things that we're saying. So the first question is, people talk to us about self-care a lot. It's a buzzword we hear, and as we all know, it can be hard to find the time for ourselves, and it can almost be stressful when people keep telling you, take time for yourself. You got to do this for yourself. What sometimes is when these people say this to you, you need to say to them, how can you help me find time for myself? Can you come sit with him? Is there an errand that you can run? So sometimes when you tell people who don't have a chance to blow their nose to take time for themselves, it's hard and it can almost be frustrating. But ask for help to others to help you have that time. David, do you have any tips for dealing with the stress of caregiving?
I think your advice about in your comments are so relevant. For me, I guess I turn to things that I really love to do. So, for example, several years ago, I had the opportunity to become a docent at the San Diego Museum of Art. And for me, that's a place where it's sort of my place. It's in a beautiful spot in the park. It's an opportunity to talk with people about art, completely takes me away from the rest of the world. It's one of those activities that I lose track of time in. And so to find something like that, more recently, I've begun cycling again. And just going for a bike ride just clears my head. So you have to find your own thing. I'm again looking through the gallery. I know I have one friend here who is the most avid knitter I've ever known, and it's great. It's what keeps her going. It becomes meditative. So the challenge is to find time, and that's something that you just got to figure out how to do it. It's so important. You can't leave it out. It's like sleep. Really, you can't live without some time for you. If that helps.
Yeah, definitely.
When people say, you got to take care of yourself, well, like, no kidding, but
Right.
how am I supposed to do that?
Exactly. And as the doctors all tell our people with Parkinson's, you need to exercise. So do caregivers. And it helps make you feel better too.
It does.
And I just wanted to a quick comment that like in addition, I totally agree with David about finding something you love and just making the time for it. Basically, like for me recently, it's been starting a tap dancing class again, and that's something that I just really enjoy, and it's just very fun. But I just want to comment that of course it's not always possible, because so much of helping someone is around maybe cooking, and I know for my mom, helping her get dressed and things like that. But when I'm there for the entire day or night or a whole stretch of time, there is time to do very enjoyable things with her. So like, especially during the pandemic, I mean, we're just spending so much time in the backyard and gardening, and sort of like, what can I do with her as well that is enjoyable for me. So it's not that every moment I'm just kind of sacrificing my own pleasure for this other person. But I mean, it's really much better when we can have fun, go, if I'm pushing her in the wheelchair, I'm getting exercise, that kind of like a compromise type things. Yeah.
That's awesome. Thank you. Okay.
I'll add into what
Okay.
Maya said too about doing things with Charles. Like, I was trying to think of, at first I thought, well, I don't think I do very much self-care. Maybe some little things, and then one larger thing, which I can talk about later. But a lot of the things are with him that we really have fun doing. So, we work out, and we walk, and we play, and we laugh, and we listen to music. And those are all wonderful for me too. So like you said, Nessa, at first, when Charles was diagnosed, and as things got more intense, friends would say, what are you doing to take care of yourself? And I'd be like, when am I going to do that? And what am I going to do? But as we have a lot of really fun things that we do together too. So that's very positive. Like Maya, it's not all about self-sacrifice, and so we play, which
That's
is
great.
so fortunate.
Yeah, Mike and I play backgammon most afternoons. And this, I figure, is also good for his manual dexterity in picking up the pieces and his cognition in counting and moving. And he still beats me most of the time, so his cognition is still very good, which is great. There's another issue that I know I've noticed a lot, and I bet you have too, that there's kind of a fine line of helping your partner or doing too much. Maybe I sometimes think of it as mothering, but everybody else doesn't necessarily think of it the same way. But of how much to do and what not to do. And Sarah, can you speak to that a little bit?
Yeah, this is something that I've struggled with for a while. Travis is a very independent person, and if he doesn't feel that he needs help, even though he looks like he needs help, it can sometimes upset him. So I often just ask, do you need help with that, or how are you doing? I don't want to be somebody who's taking over and taking control and telling him, no, you have to sit here, you have to do this, because it's easier for me sometimes to just do it myself. But to allow your person to do the task themselves if they feel that they can, and just stay in communication about it. Don't just assume you have to do everything.
Yeah, sometimes I might have to ask 2 or 3 times. Do you want help? Do you want help? Maybe by the 3rd or 4th time he'll want help. But maybe if he can get it done before that, he doesn't need it. So
I would just say, I think it's always good to ask what they want, and how sort of establish some understanding that for them that I can't always read. I think this is something that's going to come up. I can't always read what he needs in the moment. So it's helpful if I can get some cues, but also I may ask him, what can I do here? What is it that you want me to do? And sometimes it's nothing. And I have to just allow that to happen. Even though I know I could do it faster and easier. It seems silly that I'm not just doing it. I have to let that go and not step in.
I know that feeling when my husband is with the remote, the TV remote, forever and ever and ever. So, but he still has the remote. But I'm going to jump to a question since
I just wanted to say something real quickly.
Yeah.
One of the things that has really helped us so much is me letting Charles do more things on his own, even if, he's said for quite a while, let me do that. So what if I'm slower? And allowing him to do more is great for both of us. It improves our relationship. He feels better, I feel better. And so that I think that's really important.
Yeah. And I agree that the communication part of it is crucial, because there are some days where your person can do everything and you want to let them do whatever they can do. And then there are some days when they're just off and nothing is right and you need to do more for that person. So the communication is really crucial. And communicating with people with Parkinson's can be very difficult. The problems are real, whether they have the masked face where they don't show the emotion on their face, or if they're laying down a lot. Do you know if they're having apathy or being lazy? Like, which one is it? Also, people with Parkinson's speak quietly and sometimes slur their words. So there's all kinds of problems with communication, but it is so important to keep the communication going so that we know what's going on with our partner. And who haven't I hit? How about Charles? Sorry. Can you talk to us a little bit about how you keep communication, how you manage that?
Sure. I think one of the things, and this is incredibly hard for us to do as caregivers, because we have an appropriately working brain, and so we generally expect things and responses and reactions to be fairly immediate. That's how you go out to the store, the reaction is immediate when you talk to the clerk, whatever. And it takes a lot of effort to go ahead and step back and slow down and to withhold your expectations of immediacy. And I really think that one of the things that can facilitate that kind of comprehension is really taking a little bit of time and effort to understand some of the more causal effects of the disease, what the underlying things that are going on inside their brain are, and why it's so slow. Because one of the tensions that can really arise is sort of taking things a little bit too personally and not really realizing that their little bit of anger or lashing out or their apathy or their inability to move properly, that's all quite literally due to brain damage. There's sensory information that goes in that has to be processed and reach other associated parts of the brain that then go back to another little part, then come back out as behavior. And the damage that it occurs really prohibits that from working the way that it's supposed to. And I think that one of the challenges is we're forced to come into this situation as a caregiver where we're sort of, to a certain extent, expected to be neurologists and nurses and have understanding of these new, fairly complex subjects that are not immediately obvious. And one of the things that helps is not just the going slow and holding yourself down, but reach out for educational elements. An app that I found to be very, very beneficial is Medscape. It's an app that it's actually a professional medical reference app, but has a lot of great detailed information about the inner workings of Parkinson's and a whole tons of other diseases, but also gives you a lot of information about the medicines and what the medicines are doing and the things that you can sort of expect. So I think that from slowing down, but also really increasing your educational knowledge of what Parkinson's really is and how the brain damage affects behavior is very pertinent and can really help make things a little bit easier in terms of understanding more what you're seeing and experiencing.
Yeah, that is really good. David or Sarah, do you have any? I mean, Sarah, you have a big challenge with Travis's communications. So this must be something you have to deal with a lot.
Yeah, he speaks very quietly, often quite slurred, and there is a very, very long delay. And that having the patience to wait for an answer, I know in the early days, like, it was really frustrating to me because I'd ask a question and I'd get no answer, and then I'd ask it again, and then I'd interrupt him. And it's a lot of back and forth like that. But I think we've got it a lot better now. And the other thing kind of relates to one of the earlier questions is, when do you speak for him? When the waiter turns to you to ask, what he wants to eat, because he comes across as either very, very drunk or, not quite all there sometimes, but he is all there, mostly there. And he does know what he wants to eat, and he can tell you. It's just, you just have to be patient, and, wait staff isn't always like that. So, yeah, you just have to wait for the answer. You have to listen carefully. You have to pay attention to what's going on off days. He might get frozen somewhere, and I'd have to go look for him and say, hey, what's up? But I have to find him to communicate that, for him to communicate that to me. So, and then there's the other thing of the emotions. They don't read right on his face. I know the first time he had DBS, he kind of got some facial emotion back, and that was amazing to me. But some days there's just no emotion on his face, so I can't tell. I think he's mad at me. But you just have to ask, what are you feeling right now, or what's going on right now? It all has to be verbal, and unfortunately that part is also a struggle.
And I would say that one thing that that you can look for. Sometimes your loved one can be giving you visual clues with their hands and other behaviors to let you sort of know a little bit about what they're thinking or feeling. Especially this was most notable when my dad became less and less verbal towards the end. But if you keep even just your peripheral vision open, you can sometimes see that he's trying to reach for either a tissue or a glass of water, and you can kind of use what they seem to be sort of maybe looking at or reaching for to try and give yourself a little bit of a cue into how you can give them a little bit of assistance.
Yes,
Yeah.
I do totally agree with that, because he'll get stuck, in the middle of the night trying to roll over, and I'll wake up and I'll have to check, like, what position is he in? Is he trying to move? Like, I have to figure it out from the nonverbal and maybe roll him onto the other side or something like that. The pointing and gesturing has become a large part of our communication.
Wow.
One
Yeah, I
of
mean,
one of the things,
patience is the big, huge thing that you've all been covering, is being patient. I'm sorry, Mary, I didn't mean to interrupt you. Go ahead.
I was just going to say that one of the aspects of communication is that Charles doesn't take in what I say often. So I'll say something to him and he either won't respond at all, or he'll say, "What?" And what we've discovered through working with one another is that it's not going in. It's not that he's ignoring me or not wanting to listen or know, but it doesn't go in. And so understanding that and really connecting before we try to communicate something is really important, and not blaming him for not listening to me. One of the things that I think happens is, I think that with Parkinson's, Charles and probably most people have to be so attentive to everything they're doing. Like, I have to pick this foot up and put it here and move this there and be careful to set this cup down that I don't miss the table. So I think there's just so much that fills his mind up that makes it really difficult to listen to stimuli coming in from the outside. And then when it's not me out in the outside world, I don't know if he tries harder or he's more attentive, but he does better outside of the house. So, but we're working it out by working on it. So.
Excellent. I have children who are, they're not so children anymore, but 29, 27, and 24, 23. But they'll get freaked out a little bit sometimes because Mike's face is so bland or looks angry, and they'll say something to me, and I'll say something to him too. Are you mad? Are you feeling good? Are you not feeling good? And he'll just go, "No, I'm fine," And the other thing about the mask is, when you take pictures, you really have to get your person with Parkinson's, you have to really nudge them to smile, because it just doesn't happen naturally anymore. But okay, so let's see, we have another, okay. I wanted to go to kind of talking about assistive devices a bit. And I know it's often hard to get our person with Parkinson's to use them if they don't feel they need them, for example, a walker or whatever. And, my husband needed to use a walker and he didn't want to. I asked him, "Please, can you do it for me? Can you do it for me so I'm not chasing you around the house and making sure can you do it for me? Can you try it for me?" And he says, "I can try it for you," So, but people with Parkinson's, they lose so much control over their lives. And we need to make sure that they still feel like they have control. And people who are in wheelchairs, for example, being in a wheelchair can really make you feel powerless because you're being pushed. And I'm wondering, I think this is an important topic, and how we can give them some power back. And Maya, your mother is in a wheelchair, so maybe you can address it feels for her and what you do to help her feel better.
Sure. Let's see, okay. Well, the first thing I'd say about it is, she can move herself around. And that was, I think, one of the first things that we did have home health coming, both physical therapy and occupational therapy, in the couple of months after her hip repair. And, you know, they showed her how, even with it's not the kind of wheelchair that you move with your hands. It's just like a transfer chair.
Right.
They showed her, you know, how you can with your feet move around the living room and, you know, pull yourself and that type of thing. And so she does that. I mean, she does that even more than maybe sometimes I want her to. I mean, but what I mean by that is, I mean, she's quite energetic and sort of restless at times. And, you know, I might be, okay, I'm bringing you dinner. And then I look around and she's gone into her bedroom, you know, looking for something or something like that. So, you know, of course she wants to be able, like anyone, to have some freedom of movement. We've talked to my mom so many times about how worried we are if she does. At this point, she can walk, but her balance is so poor that, you know, we're really fearful that she would fall again. So we're being very cautious with her, and she wears a gait belt, and whenever she walks, she's with a walker, and we just always make sure that there's someone with her. But we also have had to use alarms for her to sit on. So I think everything I'm describing is like, you know, basically, you know, we have someone with her all the time. We're making sure that she's, you know, not by herself trying to walk around on her own. However, in terms of, you know, mental health and, you know, feeling independent, I think the main, I haven't thought about this like really consciously really, but when I had a close relationship with my mom and my sister. I mean, we're a close family already. So we have a lot of, you know, interests, things in common. And just naturally, you know, kind of based on that, there's a lot of choice in how we spend our time. So, you know, if she doesn't have the choice to get up and walk wherever she wants to, like she used to be able to, you know, I certainly don't want to just program her day so that, you know, we're doing this, we're doing that, we're doing this, we're doing that, and just, you know, treat her like someone who's completely dependent on me, even though in some ways she is. So, you know, it is kind of tricky, but I'd say like providing as many choices as, you know, as feasible, and like what some people were saying earlier, you know, can I help you with that, or what would you like me to do? And you know, just, I don't know, it is sort of a funny thing with my mom, because she does have some, I think, dementia, and she has had some you know, cognitive issues in the past year in particular. So there's times that, like, she has called me mother. She's my mom, you know, but there's times she calls me mother. And you know, and if I ask her, so it's because like I'm taking on that role with her. And I said, well, daughters help their moms also. And, you know, we kind of sort out, you know, well, you know, who her mother really is, and, you know, that kind of thing. But I think overall, my mom is very confident. I mean, I think she has, you know, she has a very strong identity. So it's not that hard for, I mean, she does know what she wants, how she wants to spend her time. And it's just a matter of kind of like giving her the assistance she may need, which is primarily around mobility. So yeah, but just the other choices that you have in life besides wheelchair or walker. I mean, there's a lot, you know, there's a lot more that goes into, like, you know, how you want to spend your time, basically. Yeah.
Thank you. And I'd like to just kind of mention that, you know, even you have Parkinson's, but you're not dead. And I mean, you're alive and you still have a life and you can do a lot of things, but maybe you can't walk as far as you used to go, but maybe you still want to go to a museum. So, you know, like if there's certain things that I'm doing with my husband, we'll take a wheelchair but I'll, you know, I'll ask him and I give him choices. But if we never used a wheelchair, he would never be able to walk a shopping mall. He would never be able to walk a museum. And so, you know, there are times for assistive devices, and I just like people not to be afraid of them. Judy, did I see that Ernesto is in the room now?
Yes, Ernesto is here and we're going to spotlight him right now. Sarah, are you able to spotlight or would you like me to?
You know, I saw Ernesto pop in and I don't see him anymore.
Oh, okay.
Let's see if he comes back in.
I thought I saw him. He's
Yeah, I
a
did too.
paid caregiver.
Right.
So we thought on our panel, it would also be interesting to hear from some, but you guys don't see him there yet? Okay, I thought I saw him, but maybe I didn't.
He was in for a moment, but I think.
Okay. I'll move on to another question. Because I know this is big with a lot of us for all kinds of different reasons, and that's dealing with guilt feelings for whatever reason. I'm healthy, he's not healthy, or I'm not doing enough for him. You know, I think we all carry some guilt around, and also because we get mad at our partners sometimes, our care person. We're normal human beings, and sometimes we get angry. And you know, but my thing is, you can always go back and revisit this. And Mary, do you have any ways that you deal with, you know, when you feel like something didn't go right, you feel bad about something? You're muted. You have to unmute.
I also do what you do. Yes, I do get mad. I do lose patience. And then I also go back later and talk to Charles and say, you know, I'm so sorry. And, you know, that was me and so forth. I do feel guilty. You know, I do feel inadequate. But almost always what I come back to is, well, let's see, I'm thinking of two things at once. I almost always come back to that he's the person with Parkinson's, you know, and that, you know, it's like he and I talk about invasion of the body snatchers. It's like the former Charles is now a different Charles. And, you know, so what I'm really mad at is Parkinson's. And since the deep brain stimulation, we started having more conflict. He and I think maybe as a benefit of meeting later in life, not having other responsibilities, we were always able to resolve conflict just so easily and quickly. And particularly after the deep brain stimulation, we would get into really major conflicts that would be very difficult. And there's a person on this call that we talked to about this issue, and I want to credit him with the phrase, you know, stupid PD related arguments. So we have stupid PD related arguments. And we are, I think, doing much better with that too, primarily because we talk about it. We're very, very honest with each other. I apologize to him. He apologizes to me if he gets, you know, super defensive or mad at me. So I think it's really evolving to much more ability to resolve conflict now, and that results in less guilt and less apology and more facilitation of good communication. So
yeah, and I'm gonna ask around the other guys too, but I am gonna mention, you know, I get mad sometimes. You know what's really hard is caregiving when you're mad at the person. It's really hard when you're really mad at them for something, but you still gotta do their dinner or their drink or whatever. So, you know, sometimes I'll have to just communicate like this. I'm helping you because you need help. I'm angry, you know, we can resolve this, but, you know, we don't really have the opportunity of just getting mad and walking away, you know? It's just, you know. Do any of my other panelists want to speak to dealing with guilt feelings or getting mad? Anybody?
There's a whole lot of frustration. I mean, you can go through the spectrum of emotions that you experience, just like you're describing, Nessa. And usually when I become reactive, like it's something will just like, when I can feel that in myself, that tells me a couple of things. One is that I need to sort of back up and just listen a little harder, because 9 times out of 10, I'm not hearing it exactly right. And there's something there that I've actually missed. And the other is that I'm probably not giving enough time to take care of myself, and I'm overwhelmed and need to find a way to relax and let off some stress in the moment. It's sort of, and almost always, if I can just sort of remind myself, as Mary said, this is this is PD. This is not who David is. David's not like that, and then it helps me see through that that again.
Let me remind all of you, just for being here, how wonderful, what wonderful caregivers you all are. You know, let's just take this arm out here and this arm out here, and let's go like this and give ourselves a little pat on the back and a hug, because sometimes our person we're caregiving doesn't give it to us, and we have to give it to ourselves sometimes.
One thing that I'd like to sort of continue on with that sort of subject real quick is there's a couple of different things that I want to try and talk about. I'm trying to figure out which way to go with. One thing that we want to stay on the look for is sometimes these bad behaviors, they can get a little excessive sometimes. And sometimes those excessive aggressions can actually be a symptom of something like a urinary tract infection. And so that's where having something like a urinalysis test strip kit at home can become very handy to make sure that the aggression or whatever you're seeing is just some temporary aggression, or if it's actually a sign of something that needs to be addressed and you need antibiotics for. And this became very pertinent when we brought my dad home from the hospital. He'd spent 6 months in this rehab, skilled rehab nursing center during the pandemic. And they're severely understaffed. There's one nurse for basically 18 patients, and they're not sitting next to my dad giving him water once an hour. It's just not feasible. So when he arrived home, he had a pretty severe UTI. They didn't know it though at the time. What we found was through his behavior was, okay, let's give him the urinalysis test strip and get it addressed. And it sure as hell, that's what it was. We got the antibiotics and got it cleared up. But we also experienced some of the worst behaviors that you would imagine. My dad was never physically abusive, but he lashed out at me and my mom a couple of times. And it's strange because these people have very little ability to move, and then suddenly they're angry and they'll take a swing. And it's the sort of fight or flight system kicking in and overriding and bypassing all of the other elements. And it was particularly hard on my mom to see him lashing out like that. But one of the things that I think sort of helped me was sort of, like I said, a little bit of education for me to kind of be aware of what was causing it, but also stepping back and realizing that I'm having to treat him a little bit like a child, a little bit like a toddler who lashes out, and you have to kind of, restrain him in similar sort of fashions. And it's hard to be almost condescending in those moments. And you feel guilt over it, but you need to recognize that you are doing the best that you possibly can, and you're doing it for both yourself and for them. And to never let yourself beat your own self up over some of these reactions and feelings and emotions that you're having as you're trying to deal with all of this.
Good, very good.
I just add, someone, a friend at a support group recently made the comment that as a care partner, you have to sort of do this dance between staying connected and being a little separated. That just depending on the situation, and not it's hard. It's hard.
Very true.
Vanessa, we're getting close to time, but we'd like to open it up for questions from
Okay.
is that possible?
Yeah, that's fine. I think that we got to,
Are there any burning questions?
the only other kind of question was that about partners, we were going to talk about how a care partner should go with their person with Parkinson's.
Oh, this is
To
important.
the doctors,
I think you should bring that up.
you know, that this is an important thing that a caregiver can do, a family caregiver or a paid caregiver, to go with, because your person with Parkinson's might not be aware of everything that's going on with them. Also, they just might not remember it at that moment. And, you know, and you can be a little bit more objective than they can be.
I would say that it's, you really, as a caregiver, really are the best eyes and ears that the doctor has. You reporting everything that you see as you see it, as opposed to the patient trying to give their own subjective opinion. You really help the neurologists provide the best medical care that they can by really being open and honest and keeping and reporting everything that you see as you see it.
Yeah, sometimes your partner may look at you like, what are you saying I'm doing? But you know, you got to keep it honest.
And
Okay,
to,
what do you want to?
Charles will, he doesn't remember a lot of the things that the doctor tells him, but also when he is asked how, you know, what would you like to talk about or how are you doing? He says, great, I'm doing great, fine, you know. So that is important to contribute a little bit in there too.
Right, right.
We can have a conversation before the appointment as well to say, what do we need to talk about this time? Is there and some good advice I've also heard is sometimes there are a lot of things going on, but try to find the one thing that you really want to deal with, and deal with that one thing and then deal with another as you go along, sort of one step at a time. It gets complicated sometimes.
Yeah.
And in on a related note, even beyond just your neurologist visits, if your patient somehow ends up going into the emergency room for whatever reason, a lot of ER doctors and nurses, they're not experts on PD. And so you can continue to be a very active advocate for them in these situations, trying to be aware of the things that are going on in the hospital as they're dealing with your loved one. Because one issue, as a small example that we had, was my dad was sort of acting out in the ER due to complications from a UTI, and they gave him a drug called haloperidol, which is very, very, very much not something you are supposed to give a Parkinson's patient. Mm-hmm. And that again comes with being aware of the medicines that can and cannot be taken by Parkinson's patients, but just going ahead and being the active advocate and raising your voice in the situations that it's called for, whether it's the neurologist's office or the ER, primary care, whatever, you name it.
And just to say this, maybe this seems obvious, but if you're going to the ER, if you're going to a regular doctor's appointment and they tell you you can't go in, only one person, the patient can go in, don't accept it. Don't accept it. Go in with them. Explain that you have to go in, that simply is not an option to not go in. And
being a good caregiver, doing that.
And they always say yes. That's happened to me. I mean, sometimes you have to command it, but they will say yes.
And I think that goes along with that sort of demanding your space and your presence. That goes for being in public in general. You know, it's very important for us as caregivers to go ahead and go out with our loved ones to restaurants, to baseball games, basketball games, the museums, and don't apologize for your presence there, even if people are staring or feeling weird. Demand your space, take ownership of it, and disregard everything else. You are allowed to take up all your space and presence in public, wherever you happen to be, restaurant, museum, or otherwise.
I love that. So Judy, do we
Yes,
have
I
more
see a
questions?
hand up. I do see a hand up. Bruce?
Yeah.
did you
Yeah.
wanna-
I just want to say that my sweet wife has dementia with her Parkinson's. And when we go out, I give her as much space and time as she needs to express herself, but she just can't. She loses her words and her thoughts. And people will start to stare, the waiters, the wait people, so on. And I say, I'm not afraid to say, and she's telling me, my wife has Parkinson's. She has dementia. She has difficulty expressing herself. I'll speak for her. Please be patient with us. And I've never had a problem once I do that.
That's great.
Is there anyone else? We can open it up. We can go a couple more minutes if that's possible.
Do you have questions in the chat, Judy? I don't know.
You know, Sarah, we do actually have had some questions. A lot of them, there have been very specific things some regarding Lewy body, and I think that what we may want to do is we'll put the chat questions. There's actually been wonderful conversations going on in the chat as well. And I think that we're going to allow you to see the chat. We're going to send that to you as well. There wasn't anything, Sarah, was there any one question? We want to make sure that the app, Charles, it's Medscape, correct? Is that what it's called? We did have a question about that.
Yes, it's Medscape. There's a website. There's also an app for it. You can sign up for it. It's free, but there's a lot of great information and resources. There's a drug interaction checker there so that you can literally input all of your patient's meds that they're taking, and if you want to check and see if you should give them NyQuil or something, you can check and see if there's any negative interactions that you really need to be concerned about or minor stuff.
Right.
It's very useful for learning about meds, about the disease and other things.
Someone also did ask about, has anyone had any success using a microphone to help with low volume speech? And I know that some people, we did discuss.
We tried it in a support group.
Right.
It was very awkward. It wasn't like a cordless mic because it was attached. It didn't really, because some people in support groups are so soft. It didn't really work in that sense. I don't know if anybody else knows of any other devices.
Right. And there were a couple questions about freezing. We did have a question, and then someone also made a comment about it, of ways of helping that. Would any of you like to address freezing along the way?
One thing that I sort of found is kind of treating we sort of wobble from left to right as we walk. And if you can do a couple of things, one, make sure that their walker is tucked underneath them so that they're not feeling like they're really leaning out and losing their balance, but also grabbing a hold of their belt and swaying a little bit left to right can help sort of kick in the sensations necessary to get their hips and legs where they want them to be. And there's some other things like the clapping and the rhythmic elements to try and get them to move on time. Right. Practicing knees up, getting their knees to go higher so that they can then move into a more forward motion. Those are some of the keys that have worked for us.
There's a good question here, that the comment question. You all seem to be farther along than we are. How did you handle the initial? I just lost it. How did you handle that transition? And I think this is an important one. Sarah, I want you to maybe comment on this for us, because Travis being young onset and how that worked for you. I think it's going to be interesting for people to hear how you guys have handled that, like how being not gone from newly diagnosed to where you are today.
Well, the initial transition was pretty rough. Travis is a very strong person who is used to being able to do like heavy lift, do whatever he needs to do on his machine. And I'm used to him being that way, or I was. So it was a really hard transition when he started losing the ability to do things. Just trying to negotiate doing things for him without upsetting him. It was a struggle, and there were a lot of long conversations about, look, like, you can't. I'm not a punching bag here. It's not my fault. I didn't do this to you. And we've worked through like how to communicate with each other in a lot of ways. And then there's still, flashbacks. I think it's important to keep doing what you want to do, but maybe like your hobbies or how you're enjoying your life has to be modified in some way. There was a struggle with his medication earlier on before he got the DBS. He got very, very sick from some of his medication, too much Cinemet. It was a lot of vomiting. But you just have to keep working through until you find something that helps, because there's not just one way to treat this, and there's not just one way to do the caretaking. And I'm still trying to adapt my life. You guys talk about the importance of going to doctor's appointments. Most of his doctor's appointments are during the day. I don't make it to the majority of them, and that's something that I think I'm going to have to change, if I can figure out how.
Well, you might now with the telecommunicate, you might be able to zoom in or FaceTime in. And I know that Judy sometimes couldn't get appointments for her husband, Sandy. So she'd call in and she would be on the speakerphone.
Right.
So,
That's a good idea.
We did FaceTime and we did call-ins because I was working full time. And it was really the only way I could do it for many appointments. And it was really, and now the doctors are really open to doing virtual appointments. So it makes it much easier to do it that way now.
That's a really good idea.
Yeah.
I wanted to say too, as a way of encouraging the person who asked the question and other people that may think they're not very far along, it's been a really long, hard process. And even though we'd already been working on it for numbers of years, after Charles got the DBS, was so difficult for, I'd say, maybe 6 to 9 months. I thought I was going to have to check myself into the mental institution. So, and now starting about maybe a month or so ago, I started in therapy for myself. That's part of my self-care. And so it's not easy. So and I'm sure it gets harder. So, it's ongoing.
Well,
Just keep working on it.
I want to thank everyone. I think that this could be we could definitely have a part 2 to this event. It's been a great spirited conversation and so much wonderful information. And I really want to thank you all for joining us for our Let's Talk Parkinson's presentation tonight. Just so you know, PCLA has 2 support group meetings each month, and they are, this is what happened last time, Sarah. I lost my notes, so give me a moment here and I'll get it back up. We have 2 support groups. Here we go. I got it. Thank you. I just don't want to give the incorrect time. Though our Caregiver Cafe daytime meeting, that one will meet on Wednesday, this December 1st at 11 a.m. Pacific time. And that's with Juanita. Okay, that's terrible. With Juanita, she is a trained social worker, Juanita Thompson. And our evening meeting is on Monday, December 20th. That's with me. It allows you to have a couple different perspectives on doing caregiving and different ways of doing it. You will receive an email after this event to all of the participants. We'll have our calendar in there. We also have weekly support groups on Tuesday. We have bi-weekly support groups on Thursday. We have a young onset support group that meets monthly. And Nessa also has another support group that meets the second Monday of Monday. So what PCLA has probably 15 support groups, all which are virtual right now. So we aren't quite sure what we're going to do after the first of the year, but right now you're welcome to join us. We also want to tell you that we hope that you'll join us on Saturday, this coming Saturday, for Parkinson's Life Beyond the Basics. It's our annual education conference, and we're doing it as a webinar. Our speakers this year are all members of PCLA's Medical Advisory Board, and the topics to be covered include the latest in Parkinson's research and medications, the importance of sleep and exercise, cognitive changes related to Parkinson's, and PD-related hallucinations and delusions. And if you haven't registered yet, you'll receive a link to do so following this event as well. Let's Talk Parkinson's is made possible by our sponsors, Abbott, AbbVie, Boston Scientific, Medtronic, Synovian, and of course by you. By donating, you can join us in our mission to improve the lives of the families in our community who are living with Parkinson's. We'd ask you to donate today to reach our annual year-end campaign of $75,000. And thanks to the generous PCLA board members, donations will be matched, doubling the impact of your gift. PCLA is a nonprofit, and all donations are tax deductible. I hope you enjoy